Firstly, designing the drug so that it can be targeted right to the site where we want and it won't hamper normal cells. And conventional chemotherapeutic drugs, they do target the cancer cell, but at the same time, they do kill the normal cells also.
Cancer causes around 10 million deaths globally. According to the World Health Organization, in India alone, nearly 9 lakh people die every year from cancer.
You've mentioned the word nano. When we think about the word, it kind of feels like it's an organism in of itself. But I believe certain people would also share my confusion that, so what exactly would nanomedicine be and how is that does it work?
Okay, so nanomedicine has two partners.
Welcome to another episode of Meet the Leader. My name is Peter Ezenduka and I will be your host for today. Joining us is Dr. Ashwini Kumar, Assistant Professor at the Department of Life Sciences, Sharda University. Welcome, sir, and thank you for being with us today.
Thank you so much for the invitation.
Thank you. Specifically your field, you are more concentrated when it comes to drug delivery.
Right.
Yeah. And I think it's kind of becoming more of a concern and trend in the world today, as it is presently. However, as everything else in the world, everything has room for improvement per se. And based on that, I'd like to ask you, what engineering innovations are required to address the challenges of drug targeting and absorption, specifically based on your field?
Right. So, when we talk of drug targeting, especially in the domain of cancer therapy, so it comes on two platforms. Firstly, designing the drug so that it can be targeted right to the site where we want and it won't hamper the normal cells. And because this has been one of the most difficult challenge with the conventional chemotherapy. Conventional chemotherapeutic drugs, they do target the cancer cell, but at the same time, they do kill the normal cells also.
Yeah.
So in terms of designing the drug that can target at a particular site, those kind of targeted therapy are already there in the market, which specifically kill the target cancer cell and not hampering the normal cell. Talking in the terms of delivery of the drug, in terms of pharmaceutics, so we do have a lot of nanomedicines. If you might have heard of the word nanomedicine. So those nanoparticles are used to deliver the drug again at the cancer tissue. Leaving all the normal cells unaffected. Another challenge with the conventional chemotherapy was about drug resistance, where either there was down regulation of the target or the cancer cells would expel out the drug. When we use nanoparticles to deliver the drugs, we can design the particles in such a way that the drugs can be there inside the cancer cells for a longer period of time, so that it can get the time to kill the cancer cells. And moreover, the cancer cells won't be expelling out the drug. So these are the two aspects of when we talk of targeted therapy.
A little bit of a sidetrack in the sense of you've mentioned the word nano, and when we think about the word, it kind of feels like it's an organism in of itself. But I believe certain people would also share my confusion that, so what exactly would nanomedicine be and how is that does it work?
Okay, so nanomedicine has two partners, nanoparticles and the medicine which are conventionally being delivered. So when we talk about delivery, we have conventional mode of delivery like tablet, capsules, suspensions, ointments. But we talk of nanomedicine, we use nanoparticles. It can be a polymeric particles, it can be metallic nanoparticle. In case we are talking about metallic nanoparticles, we coat the drug over the surface and the complete formulation there is targeted towards the tumor tissue or cancer tissue. In case we are using polymers to design those nanoparticles, we put the drugs inside the polymer, those polymeric particles, and they act as a cargo to deliver the drug.
Okay. So now, how do you view the impact of nanotechnology, especially in regards to drug delivery systems in cancer therapy? And what is the potential for its future applications in improving treatment outcomes?
So, the first nanomedicine that was approved for cancer was in 1995. So way back, almost 30 years back, yeah. and that was that used a lipid nanoparticle with a drug called doxorubicin. And in these 30 years, we have almost 100 of nanomedicines available in the market for different conditions. And if I can mention, out of those 100, almost 70 are for cancer only. So we have been using lipids to create nanoparticles. We have been using the polymers. We have been using metallic nanoparticles. There are composites of metal and polymers. So people who are working with drug delivery, they are designing a lot of particles through which the conventional medicines or conventional drugs can be delivered.
Wow. But then these future applications, we've spoken about the past quite a lot. But the future applications, that's the bit that kind of like worries people, because everybody's kind of like looking more towards the future and trying to figure out what is in this for us and how is this going to affect us. So in your view, specifically as an expert, we would like to hear from.
Right.
Yeah.
So the future obviously depends on what we are doing today. And I certainly believe in a quote that today's science is tomorrow's medicine.
Sure.
Talking about, again, in terms of nanomedicines, so there are people who are working with, just for example, ultrasounds. So there are delivery systems which can get triggered by the ultrasound. So we can target the formulation right to the site, and then it can be triggered. This kind of system is more valuable in terms of therapeutic outcome than the conventional nanomedicines which we are using today. So because you are talking about the future, these kind of approaches where we utilize a lot of physics with a lot of material chemistry and pharmacology. If we combine these kind of things, talking about interdisciplinary multidisciplinary approach, we can see a bright future cancer therapy.
Talking about bright futures, Parul University has kind of like taken more of a multidisciplinary approach to research, and we are also trying to grow in every aspect, including nanotechnology. But do you, as yourself, as an expert in this particular field, do you see any room for collaboration between you and us, or your department and us?
Definitely. Science cannot be done in isolation.
Yes.
Yeah, so it's and when we are talking about medical biotechnology and we are focusing on the human body, it is the best example of division of labor. Okay, yes. Human body is the best example of division of labor, where different cells individually engaged in different types of functions, they actually are working together for the body to survive.
Yeah.
So that's how research also goes hand in hand.
Well, so I guess in the future, we'll be hoping to collaborate more, especially in regards or in the spirit of division of labor. So thank you for joining us today.
Thank you so much for that.
And we'll see you on the next episode.